I've been to every type of doctor, every type of test that has to do with maybe, my brain or veins in my brain or...
When did this start?
I've had headaches since I was probably 12 or 15. I've been to 20, 30 doctors, been on every medication, had MRIs, CAT scans. The last doctor here, basically everybody just prescribed medication. And
what do they give you? Muscle relaxants or
most of the time it's pain pills, and they say, well, when you get the headache and it's real bad, take this. And I mean, I know you're into that, and it's the same thing with me. I'm not looking to cover up the pain or make it go away. If you can. Yeah, I want to get rid of it permanently. There's obviously something in there. Yeah. So
what sets it off? When does it happen?
Believe it or not, I don't know. I've been having them so long, and you think I would have a pattern, but I don't. I don't. It's really weird. It can be literally, I can wake up in the middle of the night with them, all the way to. It seems to me how they go along would be. I'd wake up in the morning slowly. I would start getting a headache, and it would get worse throughout the day. So I would assume some kind of stimuli that I'm getting. As soon as I wake up, we used to think it was allergies. Like I said, I've been tested for everything. The last doctor said electrical phenomena was my diagnosis. So
that cracks me up. I still remember you told me that.
It's so basically, then what I've been doing is I've been going to a chiropractor.
Does it help?
No, I actually went to the chiropractor because I was actually having a lower back pain that I never had, hard to sleep. Have always had the neck back up, back of the head, side of the head pain.
Yeah.
Went to him for that. He was like, let me take care of that, snapped it, no problem, and let me take care of these headaches for you type thing. And swore he could do all this stuff for me. I've been 4 or 6 times, gave me all these stretches, and to tell you the truth, this last week I've had probably more headaches than I've had in a long time. I probably had 3 headaches since I left here last, which was probably less than a week ago.
That's not good.
No.
So your right side definitely hurts a lot worse.
Yeah, it seems like everything. My teeth. I mean, that's where I've had the teeth problems, the headaches, the popping in my jaw. I get the pain in the back of my neck. It's really weird.
And then you're popping just in your right side ear.
Yeah, like if I do that, nothing happens over here, and this like, you can literally, touch to the feel. You can just feel it. I always thought it was just a jaw, like kid, boy. I'm sure I've gotten jacked in the jaw by something, So, but the chick in there in the video said it was that she had popping, and then after it was less or gone. So,
a lot of similarities.
Yeah, it would make a lot of sense if the popping had to do with the jaw, it had to do with the headaches. Let's hope.
All right, bite on hard. 1, 2. Now go to the right. You can open big. Perfect. That's way too heavy back here. You should shoot towards number 6. You should go like this. Instead, you're rubbing up against this. And look in this. See the kite's kind of running. This is a 2-dimensional. This is a 3-dimensional rep.
Yeah.
So the kite's trying to do this. It's going back this way. It's almost like this guy here's got a lasso around that kite, not letting it do its things. Your muscles having to overwork. See a little spike? That's a representation of excess force. Shouldn't be there. See, look, it's spiking. It's going higher and higher. That's
Is
bad.
that on that big red spike on the left side and back of my mouth?
Yes.
That's when I grind, or when I do that grind, it's basically one of the only teeth that touch.
Yes. I know, I see that. Yeah. The more efficient, faster it happens, less your muscles have to work. All right, we don't want to screw anything up.
Yeah, I'm feeling teeth touch that I don't know if they've ever touched.
Right. You're going to have that by the end. It's going to all be touching. Nice and even, Steven. Home, right, okay. Let's change your world. All right, back home? The point is now we've got some protection and separation. This is huge. That's a big deal for you.
I'm gonna bite somebody dead now, too.
Yeah, right. Yeah, basically we are. I mean, how's it feel?
Good. Yeah.
I mean, I think
yeah.
We're
When
so
I close
cl-
my mouth,
My name's Megan.
I can feel basically my entire line touching.
good.
Versus before, I'd feel like this tooth and maybe these two teeth. You know, there's
Yeah.
maybe 2 or 3 points of contact when
And
I
now
shut my
it's-
mouth. Now I literally feel it sink in.
So how's it been?
It's been real good. The headache's the big thing. I always had a little bit of, the jaw pain or the jaw weakness the more I chewed. That was really all I had teeth-wise as far as my jaw hurting, my teeth hurting. The big thing was the headaches. Having 3 or 4 a week to 0 since I left.
And that was how long ago?
I think 2 weeks,
2 weeks.
tomorrow
Okay.
it'll be. As far as I know, that's probably the maybe 3rd longest I've gone in the last 10, 15 years without a headache. So it can't be coincidence. I can't imagine that it would just stop. In the last 2 weeks, one day I woke up and was like, I might be getting a headache. Took a couple aspirin just because, out of standard habit. Never did get it. Never got one again. It's phenomenal as far as I'm concerned.
How do your teeth feel? I mean, do they?
Great, yeah.
Were they
Chewing, no, I had no sensitivity. Obviously, in that night with all the stuff, but I had other teeth work done. Not sensitive. It's a lot easier to chew. Almost like I was eating a steak, and it's almost like everything is softer than it used to be. Like it's almost too easy to chew through it. If you can imagine, instead, I think normally I was just chunking it up and swallowing chunks, and now it's, like I said, I almost chew it and it almost gets mushy, which I guess is the point. So it's a new way of eating. Definitely my teeth fit better. I can feel the relaxed, I always had a little bit of tightness because of these, and just some tightness in here. Gone. The headache's the big thing though. That's by far the most amazing part. I mean, it rules my life.
How long
Or
were you
has.
dealing with that?
Since I was 12, so 25, 26 years. Been to,
And all those docs?
yeah, I've been to 20 doctors, at least 6, 7, 8 states, been on medications, had CAT scans, MRIs. Their final diagnosis here was that, not here in this office, but here in Branson, was that it was electrical phenomena, which makes no sense, and there's no way to cure that evidently, so I just took it as it was, and obviously I came in here just to have that filling that fell out fixed. And then when you introduced me to the whole bite thing and that it might be a deal, and then once we saw on the monitor how hard this was crunching and how much higher this was and my neck muscles were than this side, it made a lot of sense. I was still, I've been to chiropractors that swear they'll get rid of my headaches, that, oh, absolutely, you've got a back problem or a neck problem and all I have to do is this and you'll be fine. I have headaches walking out of the chiropractor, so nothing with, I've been to chiropractors, doctors, eye doctors. A dentist is the only thing I've never been to attack the headache problem. Obviously, I never put those two things together. But 2 weeks without a headache is a record in my book.
Almost nobody puts that together.
No, it
It's not
it
just
makes
you.
sense, but it doesn't when you don't know the logistics of it.
Yeah.
You don't put it together, but it's so much better. It's so much
Awesome.
better headaches-wise and jaw-wise.
Awesome, thank you.